So I think we have to go back to a decade ago when we had just started our foundation in 2014, and healthcare was one of our key verticals or pillars that we were proposing to support. Amongst the many causes that were available to support and which needed support, I think two causes really stood out for us. One was looking at malnutrition amongst children in India, and the other was cancer. A decade ago, you saw almost every family with a case of cancer. But then we were alarmed to see the rate at which pediatric cancer was increasing, especially for some reason, a lot of pediatric cancer in the east and northeast regions of the country. It's then that we realized that whilst infrastructure support and the availability of good tertiary care was limited, it was not just the final treatment and of the disease itself. One of the biggest challenges for these families, besides financial, was that when they came to such large cities for treatment, there was no place to stay. The model that St. Jude really proposed in terms of creating a really safe, clean, hygienic space for children to reside in during, almost a year, 9 months to a year of cancer treatment, became completely a huge gap that not just the city but the country needed, and they really filled in this gap. And so for us it was a natural alignment that pediatric cancer, being one of the most curable if detected in time and if treated well, what was the next thing that was needed? If you got the treatment, you needed to withstand the treatment, and for that you needed a safe space to reside in along with your family, so that the treatment really became effective and the children can then go back after treatment, be cured and be integrated back into society. So this huge gap is what St. Jude really kind of built out. It originally just a few centers in 1 or 2 cities, but then it really institutionalized itself, and today it's in multiple cities. The big thing about St. Jude is, so on one side I would say it had an amazing team, a team which was not just passionate about the cause, right from the founders to the management to the staff. So they were not just a very motivated and passionate team, but I think they had really got the model right. If you go into any St. Jude center, whether you did that like 15 years ago or today, they had really built out, I would say, a prototype in terms of how every center needed to look and feel, in terms of space, in terms of infrastructure, in terms of cleanliness and hygiene, what are the do's and don'ts, and also their ability to execute projects and complete new centers on time was phenomenal. And they took this prototype from center to center, from city to city, and that's how they've really been able to scale the program. So Kharghar actually came as a natural extension of the Cotton Green project. When we first started supporting St. Jude, they had one small center in Parel. The Cotton Green buildings, it was their first large project of this scale and size. I think it goes without doubt to say that with the growing incidence of pediatric cancer and with the number of children who are actually coming not just to Mumbai but to various metro cities for treatment, the need for more space and the need for somebody like St. Jude to really scale became imperative. So after their big project in Cotton Green, when the opportunity came to set up the next big project at Kharghar, which was part of the satellite campus at ACTRECT of Tata Memorial, I think it was just a need and a space that was being filled. It had to be done, and it will just accommodate many more children. And so you actually don't just need the Kharghar center, you need St. Jude to build this in many more cities, and actually India needs many more St. Judes. So Kharghar, I think, will become like this iconic model center. It probably will become their center of excellence, and it's something which actually can be replicated and reproduced by them in other cities. When you walk into a St. Jude center, I don't think you need to be convinced. I don't think anybody needs to, I don't even think the team needs to like convince you on why St. Jude. It's you just walk in and you will see not just the need, but you will see the beauty with which these centers operate. It's just like the entire staff, the families of the children undergoing treatment, everybody is so cohesive and working together as one large family. The spaces are spotless because hygiene and cleanliness is a huge need for a child or anybody undergoing cancer treatments. They are not sad spaces. They are very vibrant spaces. There's a lot of color, children are smiling, the families are happy, and it just kind of takes so much of the burden and the emotional stress for both the children and the families. So you just walk into a St. Jude center, and I think no donor needs any convincing.